Have you ever wondered how doctors make their money or why some doctors make more than others? The answer is relative value units, or RVUs. Dr. Jubal, MedSchoolInsiders.com. Let's break down what RVUs are and how they are calculated to determine how much doctors and hospitals make. First, what are RVUs? RVUs, or relative value units, are used by Medicare and insurance companies to determine how much a physician should be paid for their services based on time spent with the patient. There are both benefits and drawbacks to this model of medical pay, which we will outline later in this video. There are three different types of RVUs. First is work RVUs, or WRVUs, which represent the relative amount of physician work required to perform a particular service or procedure. If you found that extremely vague, well, it's supposed to be. Work RVUs can include everything from a 20-minute office visit with a new patient to a major operation such as inserting a deep brain stimulator. A multitude of factors determine how much physician work is required for each service and procedure, including how long it takes for the doctor to perform the service, how much effort and technical skill it requires, and how much stress is involved. The second type of RVU is practice expense RVUs. These are designed to cover the cost of running a clinic or hospital, dealing with expenses like rent, utilities, medical supplies, equipment, and support staff salaries. Without these RVUs, most clinics cannot afford to keep the lights on. The third and last type of RVU is malpractice RVUs. Malpractice RVUs account for the relative cost of malpractice insurance associated with providing a specific service. For example, inserting a deep brain stimulator is much riskier than a 20-minute appointment with a new patient. Because a neurosurgeon is taking on more risk than a family medicine physician, their malpractice RVUs are higher. When you combine work RVUs, practice expense RVUs, and malpractice RVUs, you get total RVUs. So, who uses RVUs? Medicare. Because of the current setup of the American healthcare system, what Medicare decides to do is what many commercial insurance companies follow. Although the US healthcare system is anything but simple, healthcare payments run more smoothly because everyone uses RVUs. The Relative Value Scale Update Committee, or RUC, determines RVUs. Technically, the RUC is a private committee that gives recommendations to Medicare, but these recommendations are almost always accepted in their entirety. The AMA leads this committee, which includes representatives from every medical specialty. The committee looks at survey data from each specialty to see how long it takes doctors to perform a certain CPT code. CPT stands for Current Procedural Terminology, which is a standard vocabulary for classifying different types of physician tasks and procedures. Then, the committee votes to determine whether the RVUs for each CPT are fair or need to be adjusted. Now that we have a basic understanding of RVUs, we can calculate how much Medicare pays for a particular service. We will work through two calculations, one for a routine primary care visit and one for intensive surgery. However, before we do the math, this is what you need to know about medical codes and reimbursement rates. If you've ever seen a medical bill, you might have noticed a string of random numbers attached to each service. These are the CPT codes. Each code is attached to a different number of RVUs based on how much work it takes to perform the service, called work RVUs, how much it costs the facility to offer that service, called practice expense RVUs, and how much liability the physician takes on to perform that service, called malpractice RVUs. Reimbursement rates are simpler. These are the dollar value for each billed RVU, meaning how each RVU is converted into money. At the time of this video, Medicare set the RVU to dollar conversion rate at $33.2875 per RVU. Insurance companies have their own conversion rates, often in the range of $45 to $75 per RVU. The first example is an established patient office visit that lasts between 20 to 29 minutes. The CPT code for this is 99213. The Centers for Medicare and Medicaid Services, or CMS, determined this code receives 1.3 work RVUs, 0.56 practice expense RVUs, and 0.1 malpractice RVUs. Adding these together gives a total of 1.96 RVUs. With a reimbursement rate of $33.2875, the physician should expect $65.24 every time they enter a 99213 code. Many encounters often involve multiple services. For example, the doctor could check your ear for an ear infection, medical code 99203, consult the patient on smoking cessation, code 99406, and perform a mental health assessment, code 90791, all in one visit. This means for a 20 to 29-minute appointment, the physician is likely to make more than $65.24 for their services, as they are getting RVUs from each CPT code simultaneously. If you're trying to choose a specialty or subspecialty, check out our So You Want to Be series, which provides insight into what it's like to pursue different specialties. If you don't see a specialty you're interested in, leave a comment below to make the request. The second example is the resection of an apical lung tumor. The medical code for this is 32503. CMS determined this code receives 31.74 work RVUs, 13.42 practice expense RVUs, and 7.84 malpractice RVUs. These high numbers account for the skilled work required for the surgery, the high OR costs, and the potential risk involved. This results in a total of 53 RVUs, or $1,764.23, for performing the surgery needed to remove a particular type of lung tumor. This means if you're a primary care physician and you spend 1 hour with a patient, you might earn 3.5 RVUs. If you're a surgeon performing an operation that lasts an hour, you could earn 10 RVUs. However, physicians don't pocket the entire 100% of the RVUs they make. If the physician is in private practice, they keep everything, but they also need to pay for a number of expenses involved in running the practice. And keep in mind, running an OR is much pricier than the overhead for a simple clinic visit, for example. If they work at a hospital, the hospital keeps the RVUs and pays the doctor a predetermined salary. This salary is often created based on the average RVUs they generate per month. Minimums need to be hit, and often, if a physician goes above their set monthly goals, bonuses are added to their pay. Bonuses are often noted as other reportable compensation. If you have a medical bill lying around and want to see how much the physician was paid for the service you received, go to the US government's Search the Physician Fee Schedule website linked in the description. Lastly, let's discuss the pros and cons of using a pay-for-service system. The main benefits are standardization, transparency, and incentivizing efficiency. Since both Medicare and insurance companies use RVUs to determine how much to reimburse, the entire billing process is smoother. If the government and commercial insurance companies were using completely different tools to determine how much physicians should be paid, things would get messy fast. The system is transparent because the number of RVUs associated with each medical code is public information. Anyone can search it, and the system helps ensure physicians are fairly compensated for their work. Because RVUs are the main method of payment for physicians, many physicians optimize their practices to generate as many RVUs as possible. This promotes efficiency, but presents larger challenges of maintaining quality of care. The three main drawbacks of the fee-for-service system are variability of reimbursement rates, complexity, and quality of care. If you've ever worked as a scribe or medical assistant, you may have heard physicians complaining about reducing reimbursement rates. Because RVUs are converted to dollars, if the conversion rate is low, doctors will make less money across the board for the same amount of work. This year-to-year variability can make it difficult for hospitals and clinics to make long-term plans, as they may not have the same cash flow the following year. Complexity is another serious problem for the RVU system. Many pre-meds and even medical students don't have a full understanding of how RVUs work and how they will be paid as doctors. The last and most serious drawback to the RVU system is the potential for lower quality of care for patients. Critics of this healthcare model often argue that fee-for-service care unethically incentivizes physicians to focus on quantity over quality. Since the RVU system prioritizes the number of patients a physician sees, the number of services provided, and the complexity of those services, it can undermine the quality of patient care. Fraud can and frequently does occur, as there is a financial motive to perform as many tests and procedures as possible, even if those tests are not medically necessary. This has undeniably negative consequences for patient care, hospital resources, and taxpayer dollars. Physicians shouldn't be incentivized to act like pushy car mechanics. They should be seen as trusted advisors who always act in the best interest of their patients. Since the 1960s, there has been a movement to focus on the quality of medical care, paving the path for value-based care. Instead of reimbursing physicians for each individual service they render, value-based care ties reimbursement to the quality and effectiveness of the care provided. But how hospitals and Medicare determine quality and effectiveness is where value-based care gets complex. There are countless measures hospitals can use to objectively determine the quality of a physician's care. If you'd like us to cover how value-based care is determined and the benefits of this payment system in another video, leave us a comment. While the current system can encourage medical students to pursue specialties that generate higher RVUs, it's essential to note that a lack of passion and enthusiasm for your work means you're very likely to experience unhappiness, depression, and burnout. At the end of the day, no amount of money is worth that. Choose the specialty that will give you the most personal satisfaction based on a number of factors rather than solely looking at how to maximize your income. No matter the specialty you choose, research will play a huge role in your success. Elevating your research skills while building your list of publications will open doors and give you the option to choose the specialty you most align with. The Med School Insider's Ultimate Research course distills the tactics and lessons Dr. Anderson, Dr. Patel, and I learned from earning more than 60 research items to each of our names. We each had different strengths, approaches, and methodologies, and they're combined in a complementary and comprehensive package. It's packed with over 75 course modules, resources, and templates to accelerate your progress, and access to an exclusive private community that will help you elevate your research to the highest level. We're so confident you'll love it that the course comes with a money-back guarantee, so you can try it yourself at no risk. Course access linked in the description or at medschoolinsiders.com/research course, and for a limited time, use coupon code RVU20 for 20% off the course.